A potential turning point in the spread of the coronavirus, possibly the country's first case that was community spread.
That is when a person is infected without any known connection to a person who had the virus. Now officials in California are explaining a little bit more about this new case. They say that it is a woman. She's from Solano County in California and went untested for 3 days because she did not meet the CDC criteria for coronavirus. She spent those 3 days at a hospital. Her condition got worse and she was taken to a larger hospital, UC Davis Medical Center there in Sacramento. And meanwhile, California is now monitoring more than 8,400 people who traveled from places where the virus has been spreading. Now, the concern over the coronavirus has people buying surgical masks, thinking that will protect them.
Yeah, but doctors are telling Channel 9's Gina Esposito that healthy people should not be buying these masks because it could actually only make matters worse.
A lot of people concerned about the coronavirus have been asking for masks, and today I stopped by 2 pharmacies and both are completely out.
I would say within the last week and a half, it's really spiked. We have had patients that have come in here asking, and then I've also had people calling, hey, can you go ahead and order me 2 boxes of masks?
The owner of Harrisburg Hometown Pharmacy, Sherry Everhart, says they've been out of surgical masks for more than a week now. It's the same story at Pike's Pharmacy in Plaza Midwood. Everhart says customers are worried about the coronavirus and want to know how to protect themselves.
I think that people are in widespread panic because of the coronavirus, and I think people are stocking up on the masks, and there might be perhaps a misconception that if you wear a mask you won't get the coronavirus.
In fact, doctors say masks won't protect you if you're healthy. It could actually put you more at risk. Doctors say masks could become contaminated and get you sick. They say masks should only be worn by people who are already sick to prevent the spread of the illness or by healthcare workers. In order to prevent coronavirus, the CDC recommends people avoid contact with others who are sick. The CDC says you should wash your hands for at least 20 seconds or use hand sanitizer with at least 60% alcohol. An expert who's been studying the coronavirus at UNC Charlotte says there is still a lot we don't know about it.
So we need to start to understand the biology of the virus rather than just counting the symptoms.
As for when pharmacies expect to restock, I'm told that here at Harrisburg Hometown Pharmacy, they're expecting more masks mid-March. Back to you.
We're seeing other parts of the state putting new procedures into place as a precaution. Wake County EMS has changed now the way it handles 911 calls to try to protect workers. Now the dispatcher there will ask the caller about any recent travel. The answer could send an advisory to first responders and an alert to the hospital to set up a protocol if they think this person could be at risk for coronavirus. We asked medic there about that, or medic here about that. They say dispatchers are already using a tool to help identify patients with a travel history and symptoms that might suggest coronavirus.